Welcome to Integrity's 2019 Benefits Review. Integrity Home Care and Hospice offers a full range of benefits, including medical, dental, vision, disability, life, flexible and dependent care accounts, and critical illness. Medical insurance. There are 4 medical plan options to choose from this year. The first option is the Major Medical PPO Health Plan. This plan offers a lower deductible with copays on office visits, urgent care visits, and prescription drugs. The second option is a Major Medical High Deductible Health Plan. This plan offers a lower monthly premium than the PPO plan in exchange for a higher deductible. This plan is also paired with a health savings account. The third option is a Major Medical Narrow Network, which is new for 2019. This plan does not offer out-of-network benefits, but has lower premiums and a low medical deductible, as well as a separate prescription drug deductible. There are co-pays on office visits and urgent care. The fourth option is a MEC plan, or Minimum Essential Coverage Plan, which covers 100% of the listed preventative and wellness benefits when you visit a network provider. This plan also includes additional life and critical illness benefits. The Major Medical PPO Health Plan has an annual individual deductible of $1,000 and an out-of-pocket maximum of $6,600. The family deductible is $3,000 with an out-of-pocket of $13,200. Once the deductible is met, you will only be responsible for 20% of the additional covered charges. Emergency room visits are paid at 80% after deductible. Urgent care visit is a $75 copay. Primary care visit is a $30 copay. Preventative services such as an annual checkup or well-woman exam will be covered at no cost to the employee. There is a new tiered structure for the prescription drug coverage. Tier 1 are for your prescriptions that are filled at the local pharmacy. Tier 2 are filled at your grocery stores, Walmart, or Sam's Club. Tier 3 are filled at Walgreens or CVS. There is a $100 per covered person prescription deductible. For full explanation of drug coverages, reference Understanding Your Prescription Drug Coverage on the EBC Benefits website. The Major Medical High Deductible Health Plan does not have copays and requires its members to meet their deductible first. The individual deductible is $1,500, and once it is met, the plan will pay 20% of additional covered charges until you reach your out-of-pocket maximum of $4,500. For family, you have a $3,000 deductible with a $9,000 out-of-pocket maximum. Preventative services such as an annual checkup or well-woman exam will be covered at no cost to the employee. There is a new tiered structure for your prescription drug coverage. Tier 1 is reimbursed at 20% at your local pharmacy. Tier 2 is reimbursed at 30% at your grocery stores, Walmart, and Sam's Club. Tier 3 is reimbursed at 40% at Walgreens or CVS. For a full explanation of your drug coverages, reference Understanding Your Prescription Drug Coverage on the EBC Benefits website. This plan is a good option for those wanting a lower out-of-pocket maximum. It is also eligible for a health savings contribution. This allows enrollees to put pre-tax money into a health savings account and use the funds to pay for qualified expenses. These include medical, dental, and vision services. New for 2019 is the Major Medical Narrow Network Health Plan. The individual deductible is $500 with an out-of-pocket maximum of $3,000. The family deductible is $1,400 with an out-of-pocket maximum of $5,000. Primary care visit, $30 copay. Specialist visit, $50 copay. Urgent care is $75. Emergency room visit, 80% after your deductible. Convenient care, $30 copay. Maternity, $30. Chiropractic services, 50% after your deductible. PT/OT/ST visits, 80% after your deductible. Hospital services, 80% after your deductible. Lab and X-ray, 80% after your deductible. Your CT, MRI, PET scans, 75% after your deductible. Coinsurance is 20%. Out-of-network benefits are not covered. There is a separate deductible and out-of-pocket on your prescription drugs. The individual deductible is $500 with an out-of-pocket maximum of $3,000. The family deductible is $1,400 with an out-of-pocket maximum of $5,000. Tier 1 is reimbursed at 20% at your local pharmacy. Tier 2 is reimbursed at 30% at your grocery stores, Walmart, and Sam's Club. Tier 3 is reimbursed at 40% at Walgreens or CVS. For a full explanation of drug coverages, reference Understanding Your Prescription Drug Coverage on the Benefits EBC website. The Minimal Essential Coverage Plan offers preventative services for adults, women, and children with no deductibles or out-of-pocket maximums. Benefits at a network provider will be paid at 100%, while benefits at a non-network provider will be paid at 40%. Limited medical indemnity benefit plan includes inpatient hospital stay, $100 daily benefit with a 180-day maximum. Inpatient surgery daily benefit is $500 per day, and anesthesia is $100 per day, 1 day maximum per year. Outpatient physician office visit, $40 per day with a 6-day maximum per year. Outpatient prescription drug reimbursement, $10 generic formulary, $10 oral contraceptives, 12 times a year, 1 per day. Emergency room visit, $100 daily benefit with a 3-day maximum per year. The policy also offers critical illness coverage of $5,000 per employee and group term life $5,000 per employee. For outpatient surgery and anesthesia, outpatient diagnostic X-ray, initial hospital admission, and ambulance services, please see your schedule of benefits out on the EBC Benefits website. Integrity offers a bundled package for dental, vision, and short-term disability. Your dental benefits have an individual deductible of $50 and the family deductible is $150. In-network preventative services will be covered at 100%. Basic services are covered at 80%. Major services are covered at 50%. Orthodontia at 50% with a lifetime maximum of $500. Your annual dental maximum is $1,250. Your dental network is Dental Guard Preferred, which is one of the nation's largest dental networks. Vision insurance will allow you to receive an annual eye exam for $10 once per year. Lenses are $25, or if you need progressive lenses, $100 once per year. Frames may be selected once every other year for a $135 allowance, or in lieu of lenses, you can select contacts for a $135 allowance once per year. You will have significant out-of-pocket savings available by visiting one of the Davis Vision Network locations such as Walmart, JCPenney's, Sears, Target, Sam's Club, Pearl, and VisionWorks. There are other discount services available through this plan, so please reference your benefit summary out on the EBC Benefits website. If you were unable to go to work due to a sickness or injury, would this cause financial strain on you and your family? Short-term disability pays up to 60% of your weekly earnings for up to 11 weeks should you become unable to perform your work-related duties. You may begin receiving this benefit once you have met the elimination period of 14 days. This benefit does have a maximum of 11 weeks that are payable within a 12-month period and not within the first 6 months of enrollment. Protect your income with long-term disability. Long-term disability provides a monthly income benefit in the event you become totally disabled due to a covered injury or sickness. You may elect an amount of insurance in increments of $100, from a minimum of $300 to a maximum of $6,000 per month, up to 65% of your covered monthly earnings. There is a 90-day elimination period before benefits are paid, and any pre-existing conditions will not be covered for the first 12 months. This plan does include a survivor benefit lump sum payment, which is equal to 3 months' benefit. Voluntary life insurance, a cost-effective way to support your family. Voluntary life insurance is a cost-effective way of attaining coverage for you and your family. The policy is portable, meaning you can keep the plan if you retire before the age of 65. You may select dependent coverage, but can only elect up to 50% of your employee amount for the spouse and no more than $10,000 for dependent children. This policy is guarantee issue when you're first eligible, and those who currently have coverage can elect up to an additional $10,000 each year without answering any medical questions. Flexible spending account. Use pre-tax money to help pay for qualified medical expenses. Using a flexible account is very easy. First, estimate your medical expenses for the upcoming year. Then you can elect an amount up to $2,700 to be withheld from payroll. However, if you have not used an FSA account in the past and you don't have an estimate, you may wish to start out by only electing $500, as you lose any money over $500 that was not used during the plan year. You can use these funds to pay for qualified medical expenses of you or your dependents. Qualified medical expenses include medical, dental, and vision claims. The money withheld from your check will not be taxed, meaning you will be able to use tax-free dollars to pay for qualified expenses. Dependent care account. Save money and pay for daycare costs using pre-tax dollars. Daycare can be very expensive. You can elect up to $5,000 per year to use to pay for qualified dependent care expenses, such as fees for licensed daycare or adult care facilities, before and after school care programs for dependents under the age of 13, amounts paid for services, including babysitting or nursery school, provided in or out of your home, nanny expenses attributed to dependent care, nursery school, preschool fees, summer day camp, but the primary purpose must be custodial care and not educational in nature, and late pickup fees. This money is withheld before taxes, allowing you to use those pre-tax dollars to help save you money. Critical illness. Critical illness coverage helps protect you financially should you have a critical illness such as a heart attack, stroke, or other major condition. This policy will pay you per event based on your elected amount of $5,000 to $30,000. For major illnesses such as a stroke or coma, the plan will pay 100% of the covered amount. Other illnesses such as Alzheimer's will pay 50% of the covered amount. There is a wellness benefit of $100 per covered person per year that you can collect just by going to your annual checkup. This policy is guarantee issue up to age 70. There is a pre-existing clause and cannot receive a benefit for any condition that has been treated 3 months prior to your enrollment for the first 12 months. This plan is portable, meaning you can take it with you once you leave employment. The premium is rated based on your age when you first enroll, so your premium will not increase as you age. Thank you for your time. Please contact Human Resources with any additional questions.